right, thank you for staying connected. It's Daybreak. We're on the last lap of it and the edge segment. We have Dr. Esther with us. She'll be looking at eye discharge this morning. Good morning, doctor.
Good morning. Good morning, everyone.
Okay, let's look about the eye discharge.
Hi, good morning, everyone. I'm Dr. Mrs. Esiogene Hasi, your optometrist, your eye doctor. So today we're talking about discharge from the eyes. What exactly is discharge from the eyes? You know, discharge from the eyes is actually secretions that we see from your eyes when you wake up in the mornings. Sometimes when you have infections in your eyes, you notice this discharge. They usually come on the eyes, and in the morning when you wake up, you see them. Notice this little discharge at the corner of your eyes there, close to the nose. We call it, that's the nasal canthus. Is usually present there in the morning. Some people notice a lot of it in the morning when they wake up, while some don't. And sometimes you notice that at some odd times you just notice that your eyes produce a lot of this discharge. Now, what is causing this? It may be due to an infection in your eye, especially if it's a bacterial infection. A bacterial infection causes a lot of discharge, purulent discharge, like pus-like kind of discharge coming out from your eyes. When you notice that, please take it seriously and get it treated. It may also be due to an allergic reaction. Now, in an allergic reaction, the discharge isn't so purulent. It's not just like thick pus gathering around your eyes. It's just like a slight sticky tears, or sticky discharge. It's not as thick, it's not as whitish. It's a bit transparent, or it may be whitish, but not as thick as that in bacterial infection. And it's not so much, although in the morning it may make your lids stick together. When you wake up in the morning, notice your lids stick together. Notice dried crust on your lashes that you just need to, wash off, or use your hands to remove from your eyelashes. Now, that may be an allergic reaction. Please take it seriously. It may be accompanied, and also there are other kinds of infections and other conditions that will result in this discharge. It may be accompanied with red eye, may be accompanied with blurred vision, may be accompanied with a lot of tears from your eyes, may be accompanied with pain, whatever the symptom. When you notice this discharge from your eyes, please take it seriously. And take note, it's not all the time when you notice discharge there's a problem. Some, like the regular ones that will wake up in the morning and notice, that we notice there in the morning, that one is just normal, especially when it's a little. When you notice just a little, like the corner of your eyes, is just normal. Is kind of a way of the eyes cleaning off dirt from your eyes. Many people know that already. All the dirt and dust that are settled on your eyes, when you mix with the dried tears and sort of some conjunctival secretions, they will not get the eyes, the lid of the eyes will, should I say, clean the eyes and move them to this corner of your eyes in the morning. That is just a normal condition. But when you notice a lot of it, more than normal, then get it treated. Then that means it has gone off the normal situation.
Some patients will just go to the patent medicine store or meet a pharmacist and tell them, oh, I have this discharge. So okay, just take this eye drop. Is it okay for one to do that?
Really is not. Although discharge now, most of the drugs that they give at the pharmacy, most of the time it may just be chloramphenicol, but sometimes the pharmacist, or the chemist, may want to impress and give some other drugs that they really don't know. So now, just be careful. If you are not sure, especially when the chemist is not a trained optician or optometrist or ophthalmologist or an eye care practitioner, please don't just buy an eye drop that wasn't prescribed. It's better that you have the prescription from a doctor and you take it there to the pharmacy or to the chemist and you get that particular drug that was prescribed for you. Don't let the chemist be the one to prescribe for you. It's better you see a doctor to be the one to prescribe the right drug to use. So don't just go and buy any eye drug. All right, so next time I come, we'll talk about other eye
before we go, this itching of the eyes, what can I just go to say, doctor, yes, when I'm always scratching my eyes?
Yes, that is a sign, a very common sign of allergy. And when you rub your eyes, it's a sign of allergy. It means that your eyes have been exposed to certain allergens, pollutants, or whatever. Certain particles have settled on your eyes that your eye is not comfortable with, and will react with itching.
See your doctor whenever you're having eye problem instead of visiting patent medicine store, or those people that are not qualified to take care of your eye. Mr. Ewe Osifo is with us from the Drug Law Control Committee, Edo State. Next week we will talk to you concerning drug better. This morning, this all we can take on Daybreak Tuesday's edition. Thank you for staying connected, and once again, Dr. Ese, we appreciate you for your time. Please do have a fantastic day ahead. Bye.